What I wanted to talk about today is a subject that I've touched on in the past, but it's recently gotten a lot of press and it's made it into all the media outlets. The picture of the woman with the uniboob who went to a non-board certified plastic surgeon. She went to a cosmetic surgeon and of course had this horrible result, and it's on everybody's lips right now about who's doing cosmetic surgery and who should be allowed to do cosmetic surgery. While I've said in the past that board certification is important, and I really do believe it, being board certified in plastic surgery is a very critical step. But unfortunately for the public, it's just the beginning. It would be wonderful to think that every board certified plastic surgeon is equally good at every procedure, but the fact of the matter is they're not. And so this is where there are no shortcuts for you, the public. You have to do your homework. If you don't do your homework, you are likely going to be disappointed. You are likely going to have a result that maybe wasn't, what you thought you were going to get. At worst case scenario, you're going to be stuck with the result for the rest of your life. That makes you very unhappy. So do your homework. Take the time. Get more than one opinion. I'll give you an example. I had a patient come in a few years ago for a breast augmentation. She had already seen 3 other surgeons prior to seeing me. All 3 of them told her she needed a full lift in addition to her implant. Now, a full lift involves a scar around the nipple, down the front of the breast, and in the crease. That's not something to just toss out on the table. I examined her and I told her that, in my opinion, she quite possibly could avoid a lift if I did a bit of a variant on a standard breast augmentation. And I was reluctant in offering her the lift at that time. You can always add scars down the road. You can never take them away once you've made them. So 3 against 1, the only reason she picked me is because an anesthesia person had referred her to me. So she has a surgery. Lo and behold, she didn't need a lift. Now, what I told her to do, and of course she didn't, but I told her she should go back to all 3 of those doctors that had recommended the full lift, look them right in the eye and go, I just need to know, were you recommending the full lift for the thousands of extra dollars you could charge me, or were you recommending it because you didn't know any better? Either way, you're not my advocate.